Welcome to Everyday Nursing Knowledge Lectures, and today we will learn types of central venous access. A central venous catheter or a central line, it's a catheter. Catheter means a flexible tube. It is inserted into the large vein closer to the heart, and it can be placed through neck, through internal jugular vein, or through chest, through subclavian vein, or inserted through peripheral, and is threaded into superior vena cava, a large vein closer to the heart. Or if it is inserted through the groin, it is inserted through femoral vein and then threaded or advanced to inferior vena cava closer to the heart. There are four types of central lines. They are non-tunneled central venous catheter, tunneled central venous catheter, implanted ports, and peripherally inserted central catheter. Now, what is non-tunneled central venous access? Non-tunneled central lines are most commonly seen central lines in ICU. They are inserted percutaneously through the skin into the large vein, inserted through neck, chest, or through the groin. And this is an example of a non-tunneled dialysis catheter called Quinton catheter. So it is used for a shorter duration of time. Non-tunnel CVC is used for less than 2 weeks. But if it is a femoral line, it has to be discontinued within 24 to 48 hours because of the higher risk for infection or follow the hospital policy. Non-tunnel CVCs are associated with greater risk for CLEPSIs, that is central line associated bloodstream infection, and these catheter can be inserted at bedside in ICU, intensive care unit, in OR, or in interventional radiology. Next is tunneled central venous catheter. Tunneled central venous catheter, they tunnels under the skin and enters the vein under the skin. So it requires two surgical insertion. One insertion is where the catheter comes out of the skin, that's called the exit site. And other incision is called the insertion site, where the catheter enters the vein, and between the insertion site and the exit point, the catheter travels under the skin and enters the vein under the skin. It has a cuff under the skin to hold the line in place, or a few sutures at the exit point to hold the line in place. The three types of tunnel central venous lines are Broviac, Hickman, and Grosjean. Or example for a tunnel dialysis catheter is Permacath. Now, these tunnel catheter are used for long term for several months when compared to non-tunnel central lines, and they are associated with lower risk of CLEPSIs than non-tunnel because it enters the vein under the skin. It requires surgical insertion. It's placed not at bedside but in IR or OR, and pre-preparation is required like NPO, or if the patient is on blood thinners, consult the physician to hold it overnight if needed. Third is implanted port. Implanted port is also called Mediport, Portacath, or IVAD, that is implanted venous access device. It is a venous access which is surgically placed under the skin. It has a port connected to a catheter, and catheter enters into the large vein. The port has a raised area called septum, and you can access this catheter using the needle. So it is used for long-term use, especially in chemo patients or a patient who requires multiple blood transfusion. It is associated with lower risk of CLEPSIs. Now, the fourth is PICC lines. They are peripherally inserted central catheters. These catheters are inserted through a peripheral vein in the arm and then threaded to the superior vena cava. So this peripheral vein can be basilic, brachial, cephalic, or median cubital vein in the arm. Usually basilic is the preferred choice because it is large and superficial. It is used for short to intermediate use because of use of IV antibiotic therapy, and it can be inserted at bedside. So today we learned about central or types of central venous catheter, and thanks for watching my video.